Welcome back to the ECG Series Part 2, where we continue our journey into mastering electrocardiography. In our previous session, we explored the fundamental principles of ECG interpretation, including understanding the electrical conduction of the heart and systematically analyzing an ECG. Now, we shift our focus to one of the most crucial aspects of ECG interpretation: heart rate determination and cardiac rhythm analysis. The rhythm of the heart is not just a simple beat. It is a precisely coordinated electrical sequence that ensures blood is pumped efficiently to sustain life. Each heartbeat follows a well-defined path, starting from the sinoatrial or SA node, traveling through the atrioventricular or AV node, and spreading to the ventricles. When this pathway functions normally, the heart beats in a steady, predictable pattern. However, disturbances in conduction can lead to arrhythmias, which range from harmless variations to life-threatening conditions requiring immediate intervention. In this session, we will take a systematic and structured approach to ECG rate calculation and rhythm analysis. We will explore methods for assessing heart rate, distinguishing between regular and irregular rhythms, and classifying arrhythmias based on their origin and clinical significance. Whether you are a student, a clinician, or someone with a keen interest in cardiology, this discussion will enhance your ability to recognize and interpret cardiac rhythms with precision. Let's begin. A systematic approach to ECG rhythm interpretation. Analyzing the rhythm of an ECG is much more than simply identifying whether the heartbeat is fast or slow. It requires careful evaluation of multiple components, ensuring that electrical conduction is following the correct pathway and that there are no disruptions. The first step is to determine the heart rate, as an abnormally slow or fast rhythm may indicate an underlying cardiac condition. Next, we assess the regularity of the rhythm. A normal heart rhythm is consistent, with each beat following a steady interval. However, some conditions like atrial fibrillation produce an irregularly irregular rhythm, where the timing between heartbeats varies unpredictably. Recognizing these patterns is key to identifying arrhythmias. Equally important is the relationship between the P wave and the QRS complex. In a healthy heart, each P wave represents atrial depolarization, and every P wave should be followed by a QRS complex, signifying that the electrical impulse has successfully traveled through the AV node into the ventricles. If this pattern is disrupted, such as in heart blocks, where P waves may appear without corresponding QRS complexes, there is likely a problem with conduction between the atria and ventricles. Another critical factor is the morphology of the QRS complex. Narrow QRS complexes indicate that the impulse is traveling through the normal conduction pathways, while wide QRS complexes suggest that the impulse is originating from the ventricles or encountering a delay due to a conduction block. By following this structured approach, we ensure that no key findings are missed, making ECG interpretation a logical and reproducible process. Before calculating heart rate or assessing rhythm, it is essential to understand how ECG paper speed affects waveform interpretation. The standard ECG paper speed is 25 mm per second, which means each small box represents 0.04 seconds, and each large box represents 0.2 seconds. In certain situations, such as pediatric ECGs, or cases where fine details need to be observed, the paper speed may be adjusted to 50 mm per second, which effectively stretches the waveforms. Recognizing these variations is crucial because failing to account for changes in paper speed can lead to incorrect calculations of heart rate and misinterpretation of rhythm abnormalities. Methods for determining heart rate on an ECG. Calculating heart rate from an ECG is a fundamental step in rhythm analysis. The method chosen depends on whether the rhythm is regular or irregular. For regular rhythms, the 300 rule and 1500 rule provide quick and accurate estimates. The 300 rule is simple. Find an R wave that falls on a bold ECG line, count the number of large squares until the next R wave, and divide 300 by this number. This gives an approximate heart rate. The 1500 rule is even more precise but requires counting the number of small squares between consecutive R waves and dividing 1500 by this number. For irregular rhythms, these methods are unreliable. Instead, the 6-second rule is preferred. This method involves identifying a 6-second ECG strip, counting the number of QRS complexes within that time, and multiplying by 10 to estimate the beats per minute. This provides an average heart rate, which is particularly useful in conditions like atrial fibrillation, where the rate fluctuates significantly. Understanding cardiac rhythm: normal versus abnormal. Once the heart rate is determined, the next step is rhythm classification. The heart's rhythm is classified based on where it originates and whether it is regular or irregular. A normal sinus rhythm originates from the sinoatrial or SA node, which is the heart's natural pacemaker. It is characterized by a rate between 60 and 100 beats per minute, a P wave before every QRS complex, and a consistent PR interval. This rhythm ensures that the heart maintains efficient blood flow and oxygen delivery to the body. However, not all rhythms are normal. When the SA node is unable to maintain its pacing role, other areas of the heart may take over, leading to abnormal rhythms. These can be broadly classified based on their origin. Sinus rhythms, generated by the SA node, and include sinus bradycardia, sinus tachycardia, and sinus arrhythmia. Atrial rhythms originate from the atria and include atrial fibrillation, atrial flutter, and premature atrial contractions. Junctional rhythms arise from the AV junction and are characterized by absent or inverted P waves with a normal or slow rate. Ventricular rhythms originate from the ventricles and include ventricular tachycardia, ventricular fibrillation, and premature ventricular contractions. Understanding these rhythms is crucial for identifying potentially life-threatening conditions and initiating appropriate treatment. Classifying rhythms based on regularity. Another essential component of rhythm analysis is determining whether the rhythm is regular, regularly irregular, or irregularly irregular. Regular rhythms have consistent RR intervals and predictable waveforms. Normal sinus rhythm is a prime example. Regularly irregular rhythms follow a pattern but have some variability, such as in second-degree AV blocks. Irregularly irregular rhythms show no predictable pattern at all. Atrial fibrillation is the most common example, characterized by an erratic rhythm with no P waves and an irregular ventricular response. Recognizing these patterns allows for quick differentiation between benign variations and clinically significant arrhythmias. Clinical significance: why rhythm recognition matters. Correctly identifying and classifying cardiac rhythms is essential for diagnosing heart disease, guiding treatment decisions, and predicting patient outcomes. Some rhythm abnormalities, such as sinus bradycardia in athletes, are harmless, while others, like ventricular fibrillation, require immediate emergency intervention. Many arrhythmias correlate with specific symptoms, such as palpitations, dizziness, fainting, or chest pain. Understanding how ECG findings relate to a patient's presentation is vital for making informed clinical decisions. Mastering ECG rhythm interpretation is an essential skill in cardiology. By systematically analyzing rate, regularity, P waves, QRS morphology, and conduction patterns, we can accurately diagnose arrhythmias and ensure timely intervention. This concludes Part 2 of our ECG series, but our journey doesn't stop here. In the next session, we will explore advanced ECG interpretation techniques, building on our knowledge to refine our diagnostic skills further. Thank you for joining, and stay tuned for the next chapter in this series.